quarantine centers set up for Ebola patients that come from the DRC of American citizenship. That was clear that it was not that day that the decision was arrived at. Now, it's also interesting to note that around that time, the KMPDU has given out a statement talking about this, and I'm going to read a little bit of an excerpt from that, which was signed by yourself. And you said that, as the vanguard of Kenya's health system, we are utterly disgusted by the government's apparent willingness to trade national biosecurity and the lives of its citizens for foreign aid. We will not sit back and watch Kenya be treated as a containment colony for a lethal pathogen that we did not generate. That's what the KMPDU said.
Yes.
Is that the case? That Kenya is actually opening up its borders for a lethal pathogen that it did not generate?
No, we are in a situation whereby we got to understand or get information first from America than from our country, where there was the Secretary of State, Rubio, came out and explained to Americans, and it was rightfully so, that they will not allow any Ebola cases within their borders.
Yes. That
even the victims of Ebola, those who are suspected or who are sick, will not be to America. And their plan then, therefore, was to, and this was a shift from the policy, where during the last outbreak in West Africa, the treatments of any suspected cases were being done in America. And then he continued to state that they have made arrangements that any suspected or a sick or a patient of Ebola will be brought to the country. So you see, that in itself was an indication that that there are going to be cases in the country. And the cases that are going to come to the country are not going to be those from the borders, but are going to be those suspected Americans from DRC to the country. So that's one thing that made us have this reaction. And it was because up to that point, there was no any communication from government on any arrangements that had been put in place. So to us, we were looking at this in a situation whereby, because as you know, Kenya has never reported any Ebola cases as much as we've had outbreaks since 1976. So we were looking at this, that the first time we were going to report a case, probably in the airbase that was being, the quarantine that's being put in place, was from a case that is a quarantine for the Americans. And that's why we had that reaction. We're telling government, no, if you had an engagement with Americans, we need to know what is the content of this engagement. And if this engagement is for the Americans, what is the fate of the Kenyans? What plans are there to ensure that the public are actually protected? And why would it be that the American government have no interest in their own citizen, and they think that it is easier to bring them to the country? Does it mean that this virus that is dangerous is only dangerous for the Americans and not for Kenyans? So that was really the question that we were asking at that point. And then we are out to say, how was Kenya chosen to be the point of quarantine for this particular case? Because most of the time, when there is an outbreak, a pandemic like this Ebola, it's always much easier to have containment from the epicenter. That, I mean, every force, every effort, resources, expatriates, and health workers must be sent to that point so that you reduce the spread from that point. And now, what was informing the government to have, instead of containment at that point, have a new containment in the country? So those are things that you are trying to bring up, wanted to know, because there was no any information and there was opaqueness in all that discussion. And then what is the plan for Kenyans, those in DRC, those who are working in DRC, and then those who are in the country? Yes.
You know, Dr. we look at a situation where